guys, good morning. Introduce our group 4. We'll explain about DC. Before we start the material, we want to introduce ourselves first. My name is Josephine Astagege Heredi Putri. My ID name 14, and I am as moderator.
Hello everyone, my name is Fauzia Rahma with study number 026. Now, I will present to you about allergy and bronchitis. What is allergy? Allergy is a reaction the body has to a particular food or a substance. Symptoms of an allergy reaction, they can cause sneezing, runny or blocked nose, red itchy watery eyes, wheezing and coughing, a red itchy, rash, worsening of asthma or eczema symptoms. How to manage an allergy if you have a food allergy? You should check a food's ingredients, list for allergens before eating it, antihistamines, decongestants, lotion and cream, steroid medication. Now, next disease. Next disease is bronchitis. What is bronchitis? Bronchitis is an infection of the main airways of the lungs, bronchi, causing them to become irritated and inflamed. Reason bronchitis. The walls of the bronchi cause irritation. Most cases of acute bronchitis develop when an infection causes the bronchi to become irritated and inflamed, which causes them to produce more mucus than usual. Your body tries to sieve this extra mucus through coughing. Smoking is the most common cause of chronic bronchitis. Over time, tobacco smoke can cause permanent damage to the bronchi, causing them to become inflamed. How to treating bronchitis? To treating bronchitis, 1. In most cases, bronchitis will clear up by itself within a few weeks without the need for treatment. This type of bronchitis is known as acute bronchitis. While you are waiting for it to pass, you should drink lots of fluid and get plenty of rest. 2. In some cases, the symptoms of bronchitis can last much longer. Its symptoms last for at least 3 months. It is known as chronic bronchitis. There is no cure for chronic bronchitis, but there are several medications to help relieve symptoms. It is also important to avoid smoking and smoking environment, as this can make your symptoms worse.
My name is Nurhaliza Kirahab. I'm from class 10M1A, and this video I just want to say about cough. A cough is a rapid action to clear your airways of mucus and irritants such as dust or smoke. It's rarely a sign of anything serious. Most coughs clear up within 3 weeks and don't require any treatment. Persistent. Number 1. Long-term respiratory tract infections such as chronic bronchitis, asthma. It also usually causes other symptoms such as wheezing, chest tightness, and shortness of breath. And allergy. A smoking cough can also be a symptom of COPD, bronchitis, where the airways of the lungs become abnormally weak. And then dehydration. Dehydration occurs when your body loses more fluid than you take in. When the normal water content of your body is reduced, it upsets the balance of mineral, salt, and sugar in your body, which affect the way it functions. There are several causes of dehydration: illness, sweating, alcohol, diabetes, and then hypothermia. Preventing dehydration: drink regularly to prevent becoming dehydrated. You should increase your fluid intake, as different people sweat at different rates. It's very difficult to provide specific recommendations about how much fluid you should drink. However, you should drink more than normal while exercising, and it's particularly important to keep well hydrated if you're exercising in warm conditions. This is because you will sweat more and fluid will be lost from your body more rapidly.
Hi everyone, my name Putri Giadwi Pamungkas, my number student 0028. I just wanna tell about iracha and flu. Iracha is a common problem particularly in children. It can be worrying but is usually only caused by a minor infection and will often get better in a few days without treatment. Common causes of iracha: bloom ear, infectious, glue ear, damage to the ear, earwax or an object in the ear, throat infections, a problem with your jaw, a dental abscess. How can I treat iracha? At home or paracetamol? Go to an ear specialist. Flu. About flu. Flu or influenza is a common infectious viral illness spread by coughs and sneezes. Flu symptoms. Some of the main symptoms of flu include a high temperature or fever of 38 degrees Celsius, 104 F above, tiredness and weakness, a headache, general aches and pains, a dry cystic cough.
Hello, my name is Shafika Ayu Pramesti with study number 048. Okay, I will continue the next material about disease, that is gout. Gout is a type of arthritis in which small crystals form inside and around the joints. It causes sudden attack of severe pain and swelling. Signs and symptoms of gout include the joint feeling hot and very tender swelling in and around the affected. Things that might increase of getting gout include 1. Obesity, high blood pressure, and or diabetes. 2. Eating foods that cause a build-up of uric acid. Treatment for gout: number 1. Relieve symptoms during an attack. 2. Prevent further attack. And the next material is hepatitis C. What is hepatitis C? Hepatitis C is a virus that can infect the liver. If left untreated, it can sometimes cause serious and potentially life-threatening damage to the liver over many years. Symptoms hepatitis C can include 1. Flu-like symptoms such as muscle aches and a high temperature. 2. Feeling tired all the time. 3. Loss of appetite. 4. Abdominal pain. And the last, feeling and being sick. Preventing hepatitis C is not sharing any drug, injecting equipment with other people, including needles and other equipment such as syringes, sponges, and filters.
Now, about insomnia. Insomnia is difficulty getting to sleep or staying asleep for long enough to feel refreshed and the next morning. What causes insomnia? Stress and anxiety for sleeping, environment such as an uncomfortable bed or a bedroom that's too light, noisy, hot, or cold lifestyle. Factors such as jet lag, shift work, or drinking alcohol or caffeine before going to bed. Mental health conditions such as depression and schizophrenia. Health conditions such as heart problem, other sleep disorder, and long-term pain. Certain medicine such as some antidepressant, epilepsy medicine, and steroid medicine.
Preventing. Setting regular times for going to bed and waking up relaxing before bedtime. 3. Taking a warm bath or listening to calming music. Using thick curtains or blinds and a mask and earplugs to stop you being woken up by light and noise fading, caffeine, nicotine, alcohol, heavy meals, and exercise for a few hours before going to bed.
About kidney stone. The medical term of kidney stone is nephritis, and if they cause severe pain, it's known as renal colic. What a cause! The waste product in the blood can occasionally form crystals that collect inside the kidney. Over time, the crystal may build up to form a hard stone-like lump. This is more likely to happen if you don't drink enough fluid, if you're taking some types of medication, or if you have a medical condition that raises the level of cortisol.
I will continue material kidney stones. Preventing kidney stones. Most kidney stones are small enough to be passed in your urine, and it may be possible to treat the symptoms at home with medication. Larger stones may need to be broken up using ultrasound or laser energy. Occasionally, cable surgery may be needed to remove very large kidney stones directly.
I will explain about leg cramp. What is leg cramp? Leg cramp are a common and usually harmless condition where the muscle in your leg suddenly become tight and painful. What causes leg cramp? Idiopathic leg cramp, secondary leg cramp, and medication. What's preventing leg cramp? Stretches, exercise, painkillers, and quinine. I will explain about menopause. What is menopause? Menopause is when a woman stops having periods. Menopause means the last menstrual period. Cause of menopause. Menopause is a natural process that occurs when a woman is older. Along with age, the ovary of the age will be more susceptible of the Ranger hormone. As a result, the young eggs no longer release the egg and menstrual will stop. Prevent premature menopause. 1. Knowing your risk factor. 2. Work out. 3. Don't smoke. And 4. You drink alcohol, keeping weight. That's our presentation. Please friend, do you have any question? If there are no question, we will complete them from us, and thank you. Wassalamualaikum warahmatullahi wabarakatuh.